past, I'm a longshoreman from Seattle. If you don't know what that is, I load and unload ships, and we have a guy that takes care of us, popularly known as an EAP, Employee Assistance Professional. He also is a longshoreman. He's gone through therapy and counseling and stuff, and I'm very close to him, and I asked him for some help, and he sent me to research, how do you say it? Research 3 places, because I'm his first patient to go to dual diagnosis, and I did research on 3 places, and I felt this is the best place at Sovereign Health. I think it's been the best. Sovereign Health has been the best treatment center / rehab, whatever you want to call it, in that all the other places I've been to prior to this, my job didn't have a dual diagnosis program, and I basically, for lack of a better term, demanded it. And Sovereign Health was the best, that they worked on my medication and helped me change it to the best of their ability. And I feel I didn't have enough time, even though I've been here 90 days. And from beginning to end, this has been the best. I felt the best. When I first come here, it was indescribable, the pain I was going through. My mental state, I hardly could see myself coming out of this with this relapse. The therapy here is second to none for as far as treatment centers go. Actually, just second to none, period. It's not going to go perfect from A to Z, 1 to 100, but they're going to do their doggone best to make sure your needs are taken care of, and they're not against you. On my top group, I didn't know about the research on music calming you down or agitating you until I came here, but I'd use music to, how do you say it, calm myself down or get motivated. And I come here and there's this group called Music Therapy. I believe it's led by Chrissy. And I got to play a song pretty much every week. And it was like, I got a positive comment every week, and it made me feel better. And but it was just helpful to be able to walk around in my mania or my depression or my agitation or whatever was going on with me mentally. I knew I could, based on that group, and also the family group on the weekend. There's one particular time it came into my mind that there's a prior patient here that pointed out to me not to put labels on myself, and almost verbatim, Heidi, the therapist on the weekend that does family group, said, don't put labels on yourself. Maybe I just try to not put labels on myself. So that family group helped. Process group, intense at times, but very helpful. Those are my favorites, but I don't think, in my opinion, there's a bad group here at all. I think from Dr. Sharma all the way down to the most junior house manager that you have for each person is, but I think each and every person here works here because they care about the people. And for me, I was on a behavioral model point system. In other words, I did good, I got rewarded. I did bad, I got stuff taken away. And for me, they may not put that on other people that come here, but Dr. Cho was the most unique therapist I've ever come across in my life. I'm 36 years old. I've had mental illness since I was 20. Ladies and gentlemen, I know my therapist, and she is awesome. She's very hard on you. It seems like hard on me. It seems like sometimes, but there's a reason for it, and it's really helped me immensely. She expects more out of her patients than any other patients, and even Alejandra here, in the short time she's been here, while I've been here, she's had a very calming voice when I've been agitated or upset. Never has had a negative tone with me ever. The biggest thing is don't sit there and go by each and every little thing you signed. Yeah, keep it in mind, go over it. You're here for help, people. You're not here to see about, you promised me this, I didn't get this. Keep an open mind. They're here to help you. I can't tell you that enough. This place it's awesome. So you went a couple of days without milk. Who cares? There's still juice in the back in the garage. Have a house manager go get it, or go get it yourself. It doesn't matter. And just the little things. Just roll with it. When they tell you to journal, it helps. That's the biggest thing. I still have a little bit of a problem being able to sit down and pay attention long enough to journal. But that, for the first time, this place, Sovereign Health, has been able to get me to journal. So journal. And when they take you to what you think is a crappy AA or NA meeting, or Al-Anon in one case, the way I look at the meetings is the 12 and 12 meeting. It's like, if I don't like this meeting and that meeting, let's face it, there's two that I do not like. But I'm the type of person, I'm going to rebel, and I know there's an alcoholic and drug addict that's watching this video right now that's going to be a rebel. When you get out of here, fine. I'm not going to go to a crappy meeting ever. I'm going to go to the best meeting I can possibly find. Look at it that way. Because that's the way I've tried to look at it as much as I could. And they do try to take you to the good meetings, and they switch it up. It's an awesome place. Just remember, nothing is going to go perfect from A to Z, 1 to 100. Keep praying to your higher power. Get one if you don't got one. And listen. Take the cotton out of your ears, put it in your mouth every once in a while, and listen. When I come here, I feel I was almost in a drug-induced psychosis. I was agitated, according to the labels that I got to live with in order to get help with the medicine. I have bipolar, I have borderline, I have anxiety, and there's a fourth one they think I might have. I got to get tested for after your Asperger's. I didn't know which way my head from a hole in the ground, and this place gave me hope. This place can give you hope too.